This is a review of the PureSleep mouthpiece for SnoringMouthpieceReview.com. The mouthpiece comes in this box. The box contains the mouthpiece, in its case, and instructions. The instruction manual gives details on what causes snoring, how the PureSleep device works, how to prepare to fit the mouthpiece, how to perform the fitting process, and what to expect while wearing the mouthpiece. The PureSleep mouthpiece comes in this case. Inside the case there are two separate pieces to the device. The side with the holes in it is the bottom. The side with the points on it is the top. The pieces of the device connect together in one of three configurations. This is the typical bite setting. It uses the two holes closest to the front of the device. This is the mild underbite setting. It uses the center two holes. This is the severe underbite setting. It uses the two holes closest to the back. If you have an overbite, you can use the two center holes and flip the device over. PureSleep has an airway opening of only 3 mm, making it less ideal for mouth breathing and pushing the tongue through it. To fit the PureSleep mouthpiece, boil 1 to 2 quarts of water. Then place the mouthpiece, at your correct setting, into the water while it boils, using a spatula. Keep the mouthpiece in place for 2 minutes on a low boil. After 2 minutes, remove the mouthpiece from the boiling water and wait 15 seconds, then place it on your teeth and bite down firmly. Try to keep your lower jaw forward while fitting the mouthpiece to help open the airway to reduce snoring. You should bite down into the mouthpiece for 30 seconds to fit it. After fitting it, you should see clear impressions of your teeth. The back, soft plastic, of the device should be fused together, locking in your fitting setting. If there is excess material that you find bothersome, you can cut it away. These are results from a patient before wearing the PureSleep mouthpiece, which indicates snoring at night. These are results from a patient while wearing the PureSleep mouthpiece for 3 nights. These results show that the patient had reduced snoring while wearing PureSleep. These are results of an oxygen saturation test on the patient while wearing PureSleep. These results indicate the patient could breathe properly with the mouthpiece. Periodically, you should clean your PureSleep with a toothbrush and toothpaste, or by soaking it in water with effervescent oral device cleaning tablets. When not in use, store the mouthpiece in a cool, dry place. Thank you for watching this Snoring Mouthpiece review. For more reviews on mouthpieces for snoring, visit SnoringMouthpieceReview.com.